Good evening, folks. It is Friday, March 13th, and we currently have coronavirus in 47 U.S. states, including, I think, 16 in my county and one that I know of that's admitted in critical care at my hospital. So I have gone through all of the emails. I've been getting barrages of emails from my hospital, my unit, the American Nurses Association, the CDC. I'm signed up for all these alerts. And so we got a lot of shit going on. I'm headed into work. This is my first shift since all of this kind of blew up in the United States. And I am headed in to work an overnight. It's a one and done night. I have my student with me. So I'm going to try to capture and document as much of this as possible, at least from my perspective, about kind of what I'm doing to prepare. But I do want to get to work a little bit early so that I can talk to my student. So they have not yet suspended classes for the nursing school that my student attended. They've gone to online classes, I think, let me rephrase that. They have not canceled clinicals, but they have some pretty strict guidelines. They don't want any students going into ISO rooms, and they don't want any students on units where corona has been tested positive. So I got one email. I don't know how much I'm going to be able to show as I walk in, but they have shut down certain entrances, so they will not be used for general public entrance at all. And at the other entrances, some are designated for staff, others are designated for patients only, and they are now screening all visitors and patients that come into the hospital for symptoms of coronavirus exposure, travel to those countries. So I believe I need to show my badge to security when I get there, which ordinarily I don't have to do. I don't have any symptoms of illness. I'm not going out in public with a mask. However, I am washing my hands, just like I always do, trying to be more conscious about not touching my face, which is especially difficult when I'm sitting down because I like to, touch my chin or I took my nose hoop out and I put in a stud because a lot of times my nose hoop will move and then I immediately want to touch it and fix it. So I don't want to feel any extra desire to touch my face, so I switched back to just a little stone. Let's see what it's like getting into the hospital. So the university here is officially on spring break. At least on campus, it's kind of a ghost town. There's the added risk that people are going to come back from wherever it is they've decided to go for spring break. And they're all going to go to those places and potentially become infected and then all come back and bring it to us here. So most of the schools, including the university here, have decided they're going to have only online classes for a minimum of 3 weeks after spring break. So as far as I understand, there will be no more on-campus classes. And I wouldn't be surprised if it ended up being the remainder of the semester, depending on how this goes. We're so close to the end of the semester anyway. But that really sucks for all the people who have classes that they're knee deep in and they've been working on, classes that have labs or clinical components or things that they just can't do online. So that's a huge bummer for the trajectory of people who want to graduate on time and don't want to have to take these damn classes over again. If I was midway through organic chemistry and I all of a sudden had to start doing it online, I'd be like, what? No, this is not going to go well. See, I almost touched my face again. These are trying times, but even though everybody's kind of panicking, we need to just be paying attention to our sources day to day because this is going to change as we learn new things and as more and more information rolls in. So make sure you're checking not the paid commercial news stations, but pay attention to the CDC, the WHO, the World Health Organization, the Centers for Disease Control, and also your local hospitals, community health centers, that sort of thing. So just be paying attention, guys. Pay attention every day to what your local officials are telling you. Okay, so I'm changing my shoes, which is why I'm moving weird. But that's kind of what the screening is that you just saw. They're screening visitors and other people coming into the hospital, but staff, they're not yet screening. They just had us come in through a different line. But they had people in full PPE in the skywalk ready to screen individuals coming in. So I'm in. Step. All right, guys. Well, it is really early in the morning, and I thought I'd check in with you before I go to bed. We're in the middle of COVID-19 outbreak here in the United States. We have freshly reported community-acquired COVID, so there's a lot going on and a lot is changing, and I've been getting a million emails, but my life hasn't really changed, and I'll kind of explain what I mean by that. And yes, I'm using a filter because it's late and I'm pretty sure I have bags under my eyes, but okay, so what do I mean by my schedule hasn't changed? Well, I am not experiencing shutdown of my job because I work in a hospital. I still have to go to work, so I still have to keep my sleep schedule. I have to keep my normal shifts. I really haven't left the house any more than I usually do. I made like one grocery run, and now we're pretty much just like staying in the house unless I have to go to work. It is affecting everyone else out there because like Doug works in a public library and he has to go to work, but the library is not open to the public. And as far as changes at the hospital, we're screening all visitors. We're limiting visitors to like one per patient per day. We are conserving our personal protective equipment. There's like a million emails coming out every day updating us constantly about what's happening. So I'm not really going to talk too much about that right now because it's literally changing like every time I go to my inbox. And of course my email is exploding with messages from the hospital CEO, my manager, my assistant nurse manager, the American Nurses Association, the CDC, the Iowa Department of Public Health, the Iowa Board of Nursing. Like, it's just information overload. So tonight I haven't really done much. I've worked on the website a little bit, watched a bunch of YouTube videos, I've watched some Will and Grace, but there's just so much information rattling around in this very tired brain of mine. Oh, also I can say that while every shift is going to potentially be different, I haven't really done much in terms of infection control. I'm still washing my hands between every patient, before I touch my face, before I eat food. If I cough or sneeze, I'm doing it into the crook of my elbow. I wipe down my phone, my keys, my stethoscope, anything that could potentially be like a vector for contamination. But these are things that nurses do all the time, which is maybe why we're not freaked out, because we're already living this hand hygiene life. Oh, and I can also say that I have my student with me the next 2 nights, and the school that she attends is allowing her to continue clinicals as long as we don't have any suspected or active coronavirus cases on my unit. So we hope we don't end up taking any COVID-19 patients, although we potentially could. Alright, and now I'm just remembering stuff randomly. They're also offering like on-call shifts and special like extra pay for nurses. They're asking us to pick up overtime wherever possible. They're asking us if we've taken days off for spring break, if we're staying in town, to come in and work. They're not forcing us to do that, they're just asking us to do that. I am feeling a little anxious about all this, but I'm just trying to stay calm and do the things that I'm supposed to do and stay informed and try to be a force for community education as much as I can, whether it be in person, on social media, or whatever. So I hope I'm doing an okay job of that. I'm gonna pack some food for the next couple nights, and then I'm gonna go to bed. Just, alcohol wiping down the driving wheel, the steering wheel. Well, I'm heading into work. I just wiped down my steering wheel. My boyfriend just asked me to be really careful, and of course I will be. I know this makes him nervous that I'm going out. I'm not frontline. Frontline is like emergency responders, ICU nurses. I'm like third line, but I'm a respiratory nurse, so this could possibly get to my unit. So I'm not going to talk too much on the way there because I'm trying to bring it down. So I'm doing some low-key music. I'm doing some deep breathing. I notice I've been mildly grinding my teeth. I think that's just how my anxiety has been manifesting lately. So it's time to put aside the anxiety and show up, and I'm already touching my face. So I'm now leaving my property. No more face touching. I put in a small stud in my nose so that I'm not fucking with my nose ring. I got my hair back out of my face, and I sandy wiped everything I've got on me. So the update on the world at large here in Iowa City, we have people still out jogging. There's like not as many people. It's also spring break, so we have a lot fewer people. But there's a notable increase in the number of people wearing face masks. I hope they're washing their hands because that mask isn't going to protect them if they put their grubby hands all over their faces. I noticed that most businesses are actually closed. Oh, but they put a nice new outdoor seating area here at the hospital. Look at all those turquoise chairs. So progress continues. It's outdoor seating for the warmer weather. But yeah, as I enter the hospital campus, it doesn't look like there's a whole lot going on. It is 6:30 on a weekday on a Monday, so I don't know, maybe this is normal. It doesn't seem extra apocalyptic, but let's see what it's like on the way in. Look, it's our buddy Brad. He already made a face at me and I missed it. It's the next day. Last night was pretty uneventful aside from getting into the building. Today, things are noticeably shut down. Restaurants are closed, bars are closed, coffee shops, like everything that I drove past was closed. The parking ramps are mostly empty. And I'm about to go into an entrance that I believe is a staff-only entrance because I'm trying to minimize my contact with unscreened public. Not touching any doorknobs with my hands. Oh, I guess they are screening the public at this one. But, okay, I'm off work. It's like 8:20 in the morning, and I'm about to go into the grocery store and get a few things. I'm technically on self-quarantine, but, like, I want to make one more solid run before I really lock it down tight. And as I'm walking in, I gotta be honest, even though I work in a hospital and I'm exposed to random, weird, contagious shit, probably more often than I realize, but now I'm like, oh my God, don't touch your face. Don't stand too close to people. Stay away from people that are coughing. It's just crazy and it's very real. So, this is what I'm feeling. I just wanted to check in and tell you that. And now I'm going to go inside and get shit as fast as I can and then get gas because I'm almost on empty. And then I'm going to go home and I'm not leaving again until I have to go to work again on Sunday. And it's Wednesday. Well, it's nighttime now, and I want to wrap this up. Doug's in bed. The dog is asleep too, and I'm awake, although I don't know for how much longer, but we are officially on self-quarantine and social distancing protocol. We're in a state of emergency, federally and in my state. We have everything that we need, I think, to spend several weeks in the house. And I still have to go to work, so that's really all I'm leaving for at this point. This is a big deal, and I'm not going to talk about everything because the news has been changing so rapidly that this will be out of date by the time I get this edited and posted. Emails continue to roll in, and so as of right now, unless it is a suspected corona patient or a confirmed corona patient, we are going to be using our personal protective equipment like basically the whole shift. So like if I have to wear a mask, I'm gonna wear that mask the whole shift, which is against are kind of epidemiological guidelines under normal circumstances, but clearly these aren't normal circumstances. I'm off till Sunday, which means I'm in the house till Sunday, so I think I'm going to busy myself with organizing and yoga and hanging out with Doug and watching movies and trying to spend at least a little bit of time not thinking about all this shit. I might actually buy the first season of Reno 911 because I love that show and we don't own it. Actually, I think I am going to do that. Doug and I are working our way through Twin Peaks. We're going to cook, and actually I think after I end this, I'm going to go organize the kitchen. I think I'm just going to put on like a podcast or something, put the food away, make sure things are packaged. Is that even a word? It is not. To make sure that things are packaged in ways that will keep them fresh as long as possible, that we can see everything, and then I'm probably just gonna go to bed because shit's intense. It's heavy, and I just need to go to bed. Try to get on the same schedule as Doug. Be awake during the day again. So, okay, that's it. Stay safe. There's a lot of crazy shit going on out there, so I wish health to you and yours.